bunions, how to prevent them, and how to get rid of them. Now, the technical name for a bunion is hallux valgus. There becomes a problem in the big toe where the toe starts to malform in 3 different directions. It tends to bend towards the other toes, rotate, and then elevate. Now, the big problem with this is that it can become inflamed, tender, and it really affects your gait, your ability to walk, your ability to exercise. And so you're constantly shifting your weight on other parts of your foot and ankle, and then this throws off the symmetry of your muscles, and now you may end up with knee pain or hip pain because of the compensation. So what are the causes of this problem? Well, there's 3 main causes. One is that your shoes that you wear are not fitting your feet correctly. Maybe the toe is too pointed, maybe the shoe is too narrow, and this is causing your big toe to kind of go inward. Unfortunately, these fashion shoes today are not designed to keep your toes nice and open and straight. So the first thing you need to look at is your shoes. The best thing to do when you're buying a shoe is to take the bottom of the shoe and then match your foot to see if there's space enough for your toes. And if there isn't, you're going to have to find some shoes that actually can really give your toes some space. Now, that's not necessarily going to correct this problem, but it can definitely prevent the problem. Now, number 2, having flat feet, like myself, can create a problem with the big toe. Because there's no arch, you're constantly shifting the weight forward to the toes, especially the big toe, and then that can affect the dynamics of how you step. And then the foot flares out, and now we have a lot of pressure on that toe, and so now the toe starts going outward this way. And number 3, just simply having ankle mobility issues. That could come from an old injury to your ankle or your foot, which then it caused compensation. Or it can be from having a neuroma on your foot or a heel spur or any number of reasons, including overtraining, maybe as a child with some type of exercise. So the solution is going to be involving putting flexibility back into the ankle, which is a lot of the calf muscles that we're going to be dealing with. So let's just dive right into it. Okay, so number 1, if you have shoes that are not fitting correctly, you need to get some shoes that do fit your toes. And this also includes getting socks that are not too tight around the toes. They have socks now that individually fit your toes, and that might be a really good type of sock that you should get. So this way you keep that separation. Okay, number 2, there is something called silicone toe spreaders, okay? So this is just a simple device that you can put these little spacers between your toes to keep the separation. And you would wear these a couple hours in the evening to help start to spread the toes. And number 3, the exercises, which is probably going to be the most important thing to focus on. Now, the first exercise you want to do is focusing on rotation of the foot. You're going to be making circles of the foot. There's a really good exercise that you can do where you're sitting in a chair and you're bringing your knee up with your arms. Okay, so you're isolating the lower leg, and then you're going to try to draw a complete circle with your toes clockwise, okay? And you're just going to go slowly to focus on the form to make sure you get that complete circle. And you're going to notice that it's actually difficult to do at first because there are certain muscles that are too tight and other muscles that are too atrophied or loose. But doing this circular exercise will start to put in symmetry into that ankle. So you'd simply start with like 10 rotations clockwise with your right foot, okay? And then do 10 counterclockwise with your right foot. Then you would switch to the left foot and do 10 clockwise and 10 counterclockwise. Focusing on doing this slow and doing a complete circle without involving using the leg. So you want to really isolate that ankle so you're not rotating the entire lower leg. So that would be one exercise to start with, and do this each day. The second exercise I'm going to recommend would be just standing on a tennis ball for 2 minutes. Now you're going to have to work up to this, but you make sure the tennis ball is right in the mid part of the arch, and you do 1 foot at a time, and you're standing and you're putting all this pressure on the arch. And this is really important for people that have flat feet. This will start to take pressure off these muscles that are really too tight and give you a lot of relief. So what we're trying to do with these exercises is put symmetry back into the ankle joint and muscles that are related to that. So when you're walking, you're not favoring certain muscles, and then this will allow the toe to come back. Now, realize that what's holding this thing in a certain position is the muscles. So what you're doing is you're correcting the muscles, the ligaments, and the tendons. So when you're standing on a tennis ball, you might only be able to do it for 10 seconds. So you're going to gradually start working up to being able to do it for 2 minutes each foot, once a day. All right, the next exercise would be toe raises, okay? And you want to start sitting in a chair, and you're simply going to raise your toes up, both left and right at the same time. So, and this is going to start to strengthen a muscle called the anterior tibialis, which are the muscles on the front part of the leg, the shin muscles. And you want to work up to just doing these 30 times, okay? 30 times. If you start to cramp, obviously stop and do what you can. But we're trying to strengthen on a nice, slow gradient level the front part of the muscles in the lower leg, okay? So you're going to be sitting in a chair and raising up your toes. These are called toe raises. And I recommend working up to like 20 of these, okay? So you might be able to start with 10, and then go 20, and then 30 over time. And then once you get good with that, you can graduate to doing this standing. You're going to be positioning yourself on a wall. So you're at maybe a certain degree, like maybe you're doing 30 degrees on a wall, and you're going to be lifting up your toes that way. And I put a link down below of a really good video just to kind of give you more information about that. So if we're going to be working on the muscles on the front part of the leg, now we need to work also on the back part of the legs. So this would be calf raises, okay? Stand up straight, then push to the balls of your feet and raise your heels until you are standing on your toes. So start on a chair, back and forth, working your way up to 30 repetitions. And then when you get good with this, then you would start doing it just standing up, okay? And you might want to hold a chair or the wall as you do these calf raises. You want to work up to 30. Now, what you're going to find is the muscles and the calf are going to be a lot stronger than the ones on the front part of your shin. And this is why it's going to be a lot easier to do the calf raisers than the toe raises. But I want you to do them both. And then what you're going to find is you're going to be basically strengthening the weak link, which is the front part of your leg, the anterior tibialis. And that's going to give you a lot of relief on the big toe. And the last exercise would be where you're going to be inverting the ankles, okay, as well as everting the ankles. So you're going to rock them back and forth while you're sitting in a chair, okay? You're going to work up to 30 times. Then, when you get better with that, you can do this standing. So these exercises cover all the dynamics of the motion in your ankle, and over time, it's going to really put symmetry back into both feet. Now, let's say, for example, you just have more inflammation in one big toe, okay? Not both of them. If you want to get some instant relief on that, a very simple thing to do would be to massage the opposite toe. Exactly where it's hurting on the right side or left side, you work on the exact opposite side. And as you press into the opposite big toe joint, okay, on the mirror image side, you're going to find it's very, very tender, but it's going to give you a tremendous amount of relief on the side that's actually hurting. Now, of course, you wouldn't want to do this if it's on both sides, bilateral. You would only want to do that procedure if it's on one side. However, if you do have it on both sides, what you can do is start massaging with lotion on the inside space between the big toe and the second toe. Right where you have this little web between the two toes, go down a little bit further towards the arch, and you're going to find some areas that are very, very tender in between the first toe and the second toe. I would do that type of massage on both feet. It will give you a tremendous amount of relief as you're correcting these bunions. All right, so now that you have the basic information, the best video for you to watch next is my one on flat feet.